Namaskar and good evening. Dr. Govardhan Puri, Executive Director of AIMS Jodhpur, Dr. S.S. Agarwal, President of AIMS Jodhpur, Dr. Shilpi Ikshit Gupta, Dean of Academics, judges of the High Court, members of the faculty, other distinguished invitees, but over, above everything else, the young students who are present here, residents. Well, it's truly a very significant occasion to be present here as all of you pinned up for the postgraduate course at AIMS. When you go to a conference, you're normally pinned up with the logo of the conference. Speaking for myself, I'm always worried about the fact that the pinning up of the logo on my suit will make a hole in the suit depending on how big the safety pin is. But this pinning up is not of that nature. The pinning up which you do in a conference is momentary. It is for the tenure of the conference. An hour if you are a guest, a day if you are a participant. But this pinning up is very different. This pinning up is for life. Because the institutions to which we go for our studies, particularly after we have completed our basic education, whether it's in law or management or medicine or engineering, institutions to which we go after we have developed the basic skills and knowledge of our professions define our whole life and character. These are the institutions, and AIMS Jodhpur will be the institution which will give you teaching experiences of life, your association with your patients will teach you not only about disease, but it will teach you about human handling. You are no longer young to be doctors pursuing the undergraduate medical course. You're all people who have completed that threshold and on whom greater responsibilities are going to be placed. So you will come into contact face to face with the face of disease, the face of suffering, the face of human hope, the face of despair, all a part of the life of a doctor. But in imparting care to others, you will as much learn as you will share. You will learn from your patients first and foremost, because it is those to whom we impart care. In my case, it was care to litigants who came to us in search of justice. For you, the patients who come to you from near and far, not only from Rajasthan, but other states, Punjab and Haryana, Gujarat, who all come here expecting a certain quality of care. So you will learn from their life experiences as they tell you their life stories. You will learn from the experience of your faculties as you spend hours with them discussing on the modalities for the treatment of a patient, organizing the workflow of the OT or the ICU. You will learn from your peers. You will learn from other students who are below you. You will learn from senior and junior residents with whom you have to brush shoulders every day, wondering whether you will get that coffee in your 36-hour shifts. You will learn a great deal from life's experiences. And the one thing which separates medicine from other disciplines is that learning from the books, adequate in itself, is but one small facet about the learning of life. So the pinning up ceremony which you have completed has a great significance for you because it defines your future as people who have walked through the portals of AIMS Jodhpur. And I dare say that everyone is not as fortunate as you are, nor as fortunate as I am to have been invited by Dr. Puri to come and speak to you this evening. In 13 years, AIMS Jodhpur has already acquired an invincible reputation of being at the cutting edge of knowledge and excellence. And it is no wonder then that you have two distinguished people at the head, Dr. S.S. Agarwal, who brings a great deal of experience, both from private sector and the public sector, where he has done cross-disciplinary work. Dr. G.D. Puri himself, who comes in from PGI Chandigarh, where he devoted his whole life before coming here to the search of patient care and patient treatment. Now, you'll ask me, what am I doing here this evening? How come a former Chief Justice of India is here to share a few thoughts with you on the occasion of the inaugural of the postgraduate session of AIMS Jodhpur? Let me share with you a personal story because there is something which I want you to learn from that personal story as well. I know that it might be a little bit of an embarrassment to your executive director, Dr. Puri, because he's a self effacing person. He defines that quality of greatness, which is the greater you are, the more humble you become, and the more self effacing that you become. With his permission, I'd like to share with you a story. Kalpana and I are parents to two wonderful girls who have been part of our life over the last 10, 11 years since I was Chief Justice of the High Court of Judicature at Allahabad. We had taken our daughters, who are special needs children, who have a condition called Nemolean myopathy, for a holiday to Shimla in December of 2021 and early January 2022. Our older daughter, Priyanka, developed respiratory distress in Shimla, and we were told at the best facility which was available in Shimla, well, there's nothing we can do to save the child. And we were told that it's a matter of time. So whether you keep her here or you take the ambulance down to Chandigarh, the call is for you to take. The younger sister and both of us decided that we will take the chance and we will go down to Chandigarh. And as it so happened, when we went to the ICCU, we met this very distinguished Dr. Govardhan Dutt Puri. Dr. Puri was there. You wondered when he was not available at PGI Chandigarh. There was not a moment in the day or night when he is not physically present. He knew that he was up against the wall in treating this young patient. He knew that there's so much that medical knowledge can do, the rest you leave to destiny and good faith. But equally, Dr. Puri never gave up hope. He didn't give up hope, as a result of which, 3 years down the line, for our little child, Dr. Puri is truly a hero, just like for both the parents. Every weekend, I would go from Delhi to Chandigarh while my wife was based in Chandigarh. Our child was in the ICCU for close to 42 or 44 days. And every weekend, when I would sit with the young doctors, because they had become so friendly, because I knew them, I knew their duty rosters, they would come and say hello. And Kalpana would always tell me that if there was an emergency at 2 o'clock, Dr. Puri was there within 10 minutes. Within 5 minutes, he was there. If the emergency took place at 5 o'clock, he was there within 5 minutes. Throughout the day, he was there. So one fine day, I asked one of the senior residents, I said, "Ye sote kab hai?" And the senior resident turned to me and said, "Sir, you asked a question which all of us young doctors at PGI Chandigarh are fond of asking each other. Dr. Puri sote kab hain?" ये सवाल केवल आपने ही नहीं पूछा है, हम बार-बार पूछते हैं, अभी 2 साल हो गए हमें कोई जवाब नहीं मिला। हम शायद यही सोचते हैं कि सोते हैं ही नहीं। Because even if we call him and he's at home in the middle of the night, the phone is answered in 5 seconds. He picks up the phone and he's on his way to the ICCU. No patient is too small, no patient is too big, no patient is too hopeless, no patient is beyond recall. So, this is really something which I wanted to share with all of you because these are the examples, the real life stories which must guide you in your mission of being of service to the community. All of us now are living in an age of change. Change has been brought about primarily through the use of technology. Things which were unimaginable 30 years ago are now becoming not just imaginable, but a routine. Something as small as a cataract surgery, where the patient would be closeted for 7 or 10 days in a room where there was no element of sunlight with thick specs, has now become a matter of a few minutes. And I can give you replicate examples after examples. At the cutting edge of technology, you have new drugs which are now coming in, like the GLP-1 receptors. And the new drugs are bringing in not merely treatment for that which is known, namely weight loss in the case of the GLP-1 receptors, but other unknown benefits such as the treatment of diabetes or dementia. So, medicine is full of possibilities, but medicine is still a science of the unknown. And it is between the science of the known and the science of the unknown that the true work of a doctor really lies. No one would have thought 25 years ago of the ability of artificial intelligence to read MRI scans or PET scans or CT scans with a degree of speed and accuracy which is perhaps not even known to a human mind. Because what artificial intelligence has done is in its ability to network information, collate information. The algorithms of artificial intelligence have the ability to bring together information, collate it, analyze it, and present it on a scale and speed which is unknown to the human mind. And therefore, the great challenge which we face as professionals, and you will face as doctors, is in the change which is taking place around you. Now, it is a debatable issue as to whether the ability of artificial intelligence to read a scan is even better than that of a human being trained in experience. Something which perhaps artificial intelligence can have only the experience of data networks. But as human beings, as doctors, you have the experience of feeling the human mind and the human body. But there is something which technology can never substitute. There is a great debate going on, whether it is in law or in medicine, that will we as professionals be increasingly replaced by technology? And then which is the role which we will be left with as doctors, as lawyers, as judges, if essential decision making is being taken over by artificial intelligence, or as pilots? Now, despite these questions, and this is something which all of you must learn and know, there is something fundamental to the practice of medicine which no technology can replicate. And what technology cannot replicate is the bedside touch of the treating physician or surgeon, the ability to engage, the ability to communicate, the ability to listen. Siri listens to us when we speak on our smartphones, but Siri is eavesdropping on us. A doctor doesn't eavesdrop on the patient. The doctor is in constant engagement with the patient, understanding from the stories which the patient narrates. What has gone into the makeup of this patient? What is the nature of the illness? What is the nature of the social background of the patient? Because that will treat you the line of treatment, which is not possible, but something which is acceptable and practicable. So, as doctors, the great balance which you have to draw is not just about applying theoretical knowledge, but in the treatment of illness, we can't ruin our patients by the cost or the resources which will be involved in the treatment which we are going to suggest to them. So, the same patient who say comes with a certain degree of resistance to diabetes, if that patient is from an urban area, your approach as a doctor would be very different from if that patient is a patient from a rural area. For a rural patient, you will be concerned with things which a doctor may not be necessarily concerned with if the patient belongs to an urban area. So it is this interface between the medical professional and the patients to whom you dispense care, which is the essence of your practice, which no technology can ever replicate. The other day, I was asked in the course of a session at a management institution, what do you mean by resilience? I answered what I thought was meant by resilience, but that's a question which has not left me ever since. Resilience is the ability of a professional, in this context, a professional. Of course, it is not confined only to professionals. But in your context, resilience is the ability to adapt. Resilience is the ability to stand up. Resilience is the ability to be flexible, to account for changing conditions in which we work, we survive, and we flourish as professionals. The world around us is changing rapidly. 5 decades ago, what young professionals shared with a client or a patient was treated as gospel truth. Nobody questioned the doctor. Nobody questioned a lawyer. Least of all did people question judges. But today, people question judges as well. They question their lawyers and they question their doctors as well. That has happened because of the fact that we live in an age of information. We live in an age of knowledge. When knowledge and information have ceased to be monopolies of a segment of society, there has been a wide dispersal of knowledge, perhaps as a result of the internet. But then everyone has become a judge, everyone has become a lawyer, everyone thinks that they know about medicine, and all patients think that they know all the alternatives of treatment which are available to a doctor. So the challenge before the doctor becomes even more significant because you are now dealing not merely with patients who are not uninformed, you are dealing with people who are excessively informed. But more than that, you're also dealing with people who may or may not possess an element of trust. And it is through your work, it's through your engagement with your patients that you create this atmosphere of trust, this atmosphere of faith. And in doing so, you must follow certain basic principles. The first basic principle which you as doctors must follow is the principle of beneficence. The principle of beneficence postulates that you must use everything within your control, all your knowledge, your practical experience, your acquired skills of listening, of communication, for the benefit of a human mind and body. To be of benefit to others is the first and foremost, the greatest principle of the practice of medicine. The second principle is the principle of non maleficence, that nothing that you do should result to the detriment of the patient whom you treat. So you will not treat a patient with a line of treatment merely because you're called upon in a corporate or a private hospital environment to meet targets of revenue. You will not suggest a line of treatment to a patient who does not require that line of treatment. Of course, non maleficence does not mean that you don't take your chances for being of benefit to the patient. You will, of course, have to take risks commensurate with the condition of the patient and your knowledge of that disease. I'm not for a moment advocating the practice of defensive medicine. Because if doctors were to practice defensive medicine, then what's the cause of optimism in the profession? What is meant by non maleficence is that you will not do anything as a doctor, which will cause an injury to the patient, an injury beyond what the line of treatment necessarily requires. The third major principle is that you must do everything within your power to ensure access to medicine. What is it that you learn from institutions like AIMS Jodhpur? Many of you will continue to be in the public hospital environment. Some of you will leave the public hospital environment and go into the private sector. The world is a world of opportunity, particularly when you have studied at such an institution of excellence as AIMS Jodhpur. But what is this period at AIMS Jodhpur that will teach you? I will answer that only in two examples, because nothing like real life examples. Just the other day, a former colleague of mine called me up from Chandigarh, and he was told that most likely, not at PGI Chandigarh, he was told elsewhere. I will not mention the hospital because that's not fair. He was told at another hospital that he probably requires a treatment of angioplasty and he might require some stents. And my colleague was informed that, well, the price could vary from about 2.5 to 5 lakhs of rupees. So he called me up in the evening and said, well, what do? I said, go to PGI Chandigarh. That's the last word in medicine in the area where you are. He says, that's exactly what I've done. The doctors told him there is a possibility that you may require a stent, but we will try our best. After investigations, our gut feeling is that you will not require it. The next day, he called me back and said, there were no stents required. I was told that pure medication will suffice. And lo and behold, and he was chuckling as he told me, instead of a bill of about 2.5 to 4 lakhs of rupees, guess what I had to pay at PGI Chandigarh? I left with a bill of 12,000 rupees. Talking of AIMS, my own father in law had to have a replacement of a pacemaker years and years ago. He had been operated upon for an open heart surgery, a valve replacement, and there was a pacemaker, and there was time to change the pacemaker. He used to stay in Bangalore, and he was informed in Bangalore that a change in the pacemaker would cost somewhere in the vicinity of 15 lakhs of rupees. And this was in 2016, 15 or 16. And he called me up and said that, well, he was operated upon at AIMS Delhi, and would it be possible to get an appointment at AIMS Delhi and to find out how much the approximate cost was? So I said, don't worry about the cost. You just come here. And he said, no, but I need to know because I need my reimbursement. So when my secretary, who is here with us today, went to the head of cardiology at AIMS, they said, please ask him to come here. The entire replacement was done at 1/15 or less of the cost that was suggested elsewhere. This is the power. This is the power of public hospitals. The power of public hospitals where our doctors are dedicated to one mission and one mission alone, not of generating revenues for the establishment, but of providing care to patients. And these 2 years or 3 years that you are going to be here at AIMS Jodhpur, will be a learning experience in life where the quest for public service becomes a viable option. Now, I'm not for a moment suggesting that all of you will follow in the very distinguished steps of your executive director, Dr. G.D. Puri. Some of you may have avenues elsewhere. I was so amazed to learn of this cross disciplinary perspective which is being brought in by AIMS Jodhpur. Because just as the law is opening up, so is also medicine opening up. When I became a young lawyer, there was only one option available to you. You wore a band, black coat, black pant, a white shirt, and you went to the court and started practicing law. No longer now. You have legal startups, transactional lawyering, big firms, policy think tanks. So also in medicine. So many of you may realize that though you have studied to be doctors, your path would lie in innovation elsewhere. Don't stop your natural instinct to explore the world around you. There is no one path that is available to you. And unlike, say, doctors who completed their education in the 1950s or 70s or 90s, or even I dare say the early years of this century, for you the paths are manifold. Some of you may become innovators in medical diagnostics. Some of you may lead the path to development of new technologies here in India itself. As residents, as interns, as residents, as junior residents, as senior residents, you'd be playing a very important role in facilitating research. Look at your 3 years in this institution in multi layers. At a certain level, patient care is what you will be performing, diagnosis, performing procedures, offering advanced treatments. As postgraduates, you will collaborate with multidisciplinary teams, including nurses and pharmacists, physiotherapists, social workers, who provide comprehensive patient care. The postgraduate program, in that sense, is not an ordinary academic journey. Your responsibilities extend beyond clinical training in the IPD or the OPD or the ICU or emergency and the educational aspects of medicine. You include leadership, research, and mentoring. Postgraduates are expected to contribute to the education and training of medical students and junior doctors. Postgraduates are involved in research, contributing to medical knowledge, advancing treatment methods, or developing new technologies. I was so fascinated the other day when a very distinguished and a very young, though distinguished professional who has just completed his post graduation at the All India Institute of Medical Sciences. He was again and is Dr. G.D. Puri's student. He has written a book on cardiology, young 30 plus doctor. And I thought, this is really the future. The ability to do your work in the environment in which you do, but take your work to a different level. So, as doctors, you will, of course, be doing what is routine, what you have to do. Each of us, even when I was Chief Justice of India, I had to do what was routine. Read my 60 or 70 cases every morning at 3:30. If I didn't do my routine cases, I wouldn't be able to survive as a judge. So, however high you go, you are still doing your basic medical work. That basic medical work, whether as a physician or as a surgeon, is what brings you fulfillment. You cannot forget your work either as a physician or a surgeon and then suddenly start focusing only on administration. Because to be a good administrator, you have to be first and foremost good in the discipline. You are respected by others when you are good at your own faculty, your own discipline. That is what I learned as a Chief Justice. You are respected not for the administrative reforms which you bring about, and I've been very graciously referred to as someone who led the digital transformation of the Indian judiciary. But that was after the day's work as a judge was over. During working hours, I was first and foremost administering care to that person who had lost the job, a motor accident victim who was before us for compensation, numerous other cases, whether it was service law, constitutional law, human rights violations. So, this is something which you must focus on, namely, that you must excel in the fundamental and basic task which you are about to do, namely, as postgraduates entering upon the 3-year postgraduate course, but build from that. And you build from that on the basis of your day to day experiences of life. You build from that when you deal with peers. You find that a peer, another co resident, is depressed. There's been an unfortunate situation in the family, parental ill health, paucity of funds. You will learn so much by interacting with each other. You will learn not just by interacting with your patients, but interacting with co workers in your workplace. And through that, you will then take your work to the next level, which is the last limb of what I want to say this evening, which is the limb of institution building. The reason why these institutions today, like AIMS Jodhpur, attract the best talent from across India is because of the effort which has gone into and which is continuing in terms of institution building. So, in your work which you do, never forget the fact that you represent an institution and therefore the pin-up ceremony. Pin-up ceremony is not just to show that, well, I'm a student who is doing my PG at AIMS, but I'm an intrinsic part of the institution building of AIMS Jodhpur. If you do this seriously here, you might go to AIMS Delhi, someone may go to AIMS Patna, somebody may go somewhere else, somebody may go to the Cleveland Clinic for all you know. Somebody may open their own hospital if you are a good businessman as well. But whatever you do, you will realize the importance of building institutions. Because building institutions is critical to building society. No society can flourish until the institutions which are set up for the benefit of society flourish. And institutions flourish through the expertise of individuals. And therefore, through these 3 years, you take upon yourself the important role of institution building. But remember that the world in which you live today is a world which has the potential for abuse, it has the potential of being good to others. The same technology which can prove a blessing to patients is a technology which can be used to do grave harm to human beings as well. I was reading an article recently about one of the cheapest forms of drugs which has been now used internationally, which is fentanyl. For the drugs mafia have realized that you don't have to depend either on cocoa from Colombia or on cocaine. You can manufacture cheap chemical drugs. And these drugs are manufactured cheaply. These drugs are sold on the dark web. These drugs are marketed through drones. And these drugs are therefore used to destroy public health and human lives. But in your hands lies the ability to choose between good and bad. Because exactly the same technology, not the dark web, but the internet, which is a source of evil, is a source of good. The same drones which can be utilized to supply arms across the border, or the same drones which can be used to market drugs, are the drones which we learned a little while ago which are used to provide medical care to the tribals in remote areas. So the choice is ours as human beings. How will we use our life? Will we use our lives to commercialize medical practice? Or will we use our lives, despite so many around commercializing a noble profession, but we will use our life in service of people to be of good to others? The choice is yours. Nobody else will make those choices for you. And through your careers, you will have situations of self doubt. You will have situations where you will be tempted. Remember, whatever the temptation that you confront, ultimately, there's only one person you have to answer, and that's your conscience. So I'll leave you with the thought that be the doctors that you want to be. Allow the sense of optimism about your great profession to pervade every aspect of your life. Learn medicine, learn communication, learn listening, learn good bedside manners, learn not to be arrogant, learn to be patient, patience, to be compassionate, even to those whom you know medicine has no answer, because compassion itself is its own healing in the treatment of patients. But above all, as you excel in your own knowledge, use that in being of good to your peers, to your friends, and in developing an institutional culture so that you will be worthy possessors of the great tradition of AIMS Jodhpur, and that many more will follow in your path. So many of you have come here facing hardship. So many of you have come here through parental and other sacrifice. So many of you have come here because of so much that has gone into the making of you as you are today. Your teachers, that math teacher, the physics teacher, someone who inspired you. Use that example and be of inspiration to others. What more can I say as a judge who is called upon to talk to young doctors? Thank you. Thank you, Dr. Puri. Namaskar.